capsulitis, aka frozen shoulder, what it's more commonly known as. And with frozen shoulder, we basically have a shoulder that is not able to move very well, right? And there's a lot of inflammation in the shoulder joint. We have this adhesion, basically. The joint capsule in the shoulder is so inflamed that it just can't move well. And this could be a byproduct of previous injury, immobilization, right? So it could be an injury where the scar tissue built up in there, you can't quite move it that well. Not using it, right? Immobilization, maybe you're not using it enough, and so your shoulder doesn't work as well, right? It could be a byproduct of tendonitis, lasting bursitis that has progressed now to a lot of inflammation that's just not allowing you to get motion in that shoulder. So what can we do about that, right? Well, typically this comes on around 50 years old, maybe a little longer. People, like we said, have a previous injury or they don't use it a lot. And, it's something where you want to get it moving as quickly as possible. There's 3 stages to frozen shoulder, starting in the freezing stage, then the frozen stage, then the thawing stage. And so in that freezing stage, you want to make sure that we're getting some motion so that it doesn't get so bad that we can barely even move it later in life, right? So you want to address it early as you do most things, right? And so what we're going to do is we're going to make it move in directions like external rotation, like abduction, like flexion, without moving it. So how the hell do we do that? Because most often, people that have frozen shoulder, they can't move in these directions. So we have to assist the shoulder to get that increased range of motion. So what you're going to do is take a broomstick that we got here, take the end off, people, so we can use it for this video. And what you're going to do is hold it like this. First, we'll say this was the affected shoulder that I can barely move. And now, before we even get into this, don't self-diagnose yourself, right? Online from Instagram videos or YouTube videos. This isn't intended to treat, diagnose, cure, prevent any disease. Go see your doctor if you have shoulder pain or disability, anything like that, right? So what you're going to do here is pin this shoulder, this is a bad one, to your rib cage, all right? So it's pinned there, right? You don't want it out like this. Keep it there. You have your arms like this, and you're going to push it with this good arm. You're going to push, both palms are up here, right? You're going to push it into that position using your well arm, the arm that's not affected. And we'll show you from this angle kind of what that looks like. Is my elbow's pinned in, but I'm getting it into external rotation, right? Because maybe somebody couldn't do that themselves. Let's use some assistance. Next one, put the palm over of the good hand, right, of the good shoulder. This one stays like this, arms are straight, and you're going to push with this arm, the good arm, up into abduction. Help it get up there best you can, right? See if you could do, 15, 20 reps. See if you could do these exercises 4 times a day, 4 to 5 times. Do them throughout the day. The more you do them, the more motion you're going to get back on that shoulder. And then you can start to do strengthening exercises later to help fortify the shoulder joint. But first we need to get some range of motion, right? So next, you have the same position as we did where we push the arm up like this, right? And you're forward, right? Like you're jousting, you guys. And you're going to push with the good arm, the bad arm's in front, and it goes up like that, right? So I'm using this arm back here to push. I'll show you from the side. Up like that. 3 exercises you can do for frozen shoulder, my fine feathered friends, and see what that could do for you if you have it. Right? Now, there are more exercises, but we are going to start with those. External rotation, again, is typically where people have the most limited motion, so I like to start with that and hit it early. That's your best bet for a good prognosis. Who do we got on here? Let's say what's up to everybody. It's been a long day doing wellness late. Sabine, what's up, Jen? How you doing? It sucks, Frank, I know. Yeah, it does, right? WF Collector, Mary, long time no see, baby girl. What's up? Ash, pretty girl, how you doing? Lois and Marie, how you doing? Nice to see you on here. Thanks for coming on. Sabrina, John B. Bonbon. As for now. So we got for you, folks. We'll see you more, baby. Not sure where, not sure when, but we'll see you then. Have an amazing rest of your night. Thank you very much, and happy wellness. We'll see you later.